Hello and welcome to this very new episode of Brain and Spine Surgery. I am Dr. Jaydev Panchwagh on behalf of Synapse Brain and Spine Foundation. Today we will be discussing a very peculiar case. This particular lady had a very large tumor inside her brain. Now, this case was different for the way in which it presented to us, because normally brain tumors present with either fits or symptoms due to raised pressure inside the skull, or symptoms due to the tumor destroying a particular part of the brain and the patient coming with paralysis, etc. But this patient was treated for about a year or more than that perhaps with psychiatric drugs, because her behavior had changed. She was a very quiet person and she had become very irritable, sometimes aggressive, and this was a large tumor that she harbored, and it was gradually increasing inside her skull. This tumor is of the variety which is called as Meningioma, and here you can see in a view called as sagittal view, almost filling 1/4, maybe more than 1/4 of her skull. And luckily some physician thought at some point of time to perform an MRI and this tumor was diagnosed. Till that time she was on psychiatric medicines. Her relatives thought that she is becoming senile, or they had a notion that she was having dementia, and they had really given up on her. And when this tumor was diagnosed, of course, we were very hopeful that we will be able to remove it and will be able to give her a chance for a good life again. And after about 6 hours of surgery, here you can see the patient in the surgical room. The tumor was marked on her head because we wanted to keep important areas of the brain safe. And as you can see here, this is the superior sagittal sinus, which is a big channel of blood. And this red area that I have drawn is actually the area which is responsible for our power or a motor center. So the tumor was actually coming and abutting on the motor center. So we had to be very careful in this part of the tumor, somewhere here. And that's why very careful and meticulous planning was needed. So this was the estimate from CT scan where the tumor will be, and then we made a craniotomy, large opening in the skull, and progressively resected this very large tumor. And as you can see, nearly 12 centimeter long tumor. You can see here, this is the tumor which was seen on MRI, and you can see this actually after removal. Luckily this turned out to be a benign tumor, that is non-cancerous growth, as was our estimate from the preoperative MRI. And what was important was that within a year her behavior gradually improved, and now she is back to her original self. And this is a very recent photograph. Her daughters told me that she is back to what she was, her personality wise. She is very calm and collected now. She is the mother they had before, and they had literally given up on her, but she is back to normal. So this was perhaps the largest, one of the largest brain tumors that we saw in our brain tumor center, and then we could remove it. So it is very important to remember that some brain tumors can present with psychiatric symptoms, and we have to be very closely watching patients with psychiatric symptoms, and if we are suspicious at some point of time, we have to do imaging in these patients. This was a big lesson from this tumor, and the purpose again was to spread the awareness about brain tumors. Synapse Brain and Spine Center is committed to spread knowledge and awareness about brain tumors. Students, science enthusiasts and patients seeking further information and guidance can contact the Brain Tumor Helpline on 9011333841 or 7720948948 or write a mail on brainandspinesurgery60@gmail.com. Please subscribe for more interesting videos on neuroscience and advances in brain and spine surgery. Thank you very much for being with us and hope you join us again in the next video.